Hey Hoosiers, Congressman Rudy Yakum here. It is my pleasure to welcome you to our Medicare 101 informational webinar for 2025. Every year, millions of Americans count on Medicare. As your representative in Washington, my priority is to ensure that Hoosiers have the resources and information needed to understand how Medicare works and to know all the benefits and options available to you. With Medicare open enrollment beginning soon, and with the new updates to the program this year, this discussion is especially timely. Our goal is to help you feel confident as you navigate the enrollment process. Whether you're approaching retirement age, already enrolled in Medicare, or caring for a loved one who is, this webinar is designed with you in mind. Beyond today's event, I also want to remind you that my work as your congressman goes far beyond legislating in Washington. Serving you here in Indiana's 2nd District means helping you with federal agencies. That includes assistance with the VA, Social Security, passports, or other federal benefits. If you or your family ever need help, please do not hesitate to reach out to me or my office. We are here to serve you. Thank you for joining today for Medicare 101. May God bless you, may God bless Indiana, and may God continue to bless the United States of America.
Everyone, thank you for joining us today. My name is Jacqueline Bridenour. I am Congressman Yakum's constituent liaison, and I will be co-hosting today's Medicare webinar alongside Megan Rogers, who is with the State Health Insurance Program, also called SHIP. Before jumping into the presentation, I wanted to briefly explain the services our office can provide. If you are having trouble getting a response from a federal agency, or you feel you've been treated unfairly, our office can open a congressional inquiry on your behalf to help resolve the issue or obtain the information you need to further your case. In my role as a liaison for Representative Yakum, I primarily assist with Social Security and Medicare issues. The common issues we help with include disputes involving a Medicare bill, status updates on pending claims or Social Security back pay, questions about Medicare coverage, policies, or enrollment. So if you need help with these or other federal agencies, our office is here to assist. You can contact us Monday through Friday from 8 a.m. to 5 p.m. And with that, I will turn it over to Megan to begin the webinar.
Okay, so this morning we are going to go over the basics of Medicare. We are going to cover what is SHIP, what can we help with, what do we do, who are we, who is eligible for Medicare, the process to enroll in Medicare, and then we're going to review the different parts of Medicare, Part A, B, D, and then our two secondary options, which is a Medigap or an Advantage plan. And then we're going to cover some questions. All right, so what is SHIP? SHIP, like Jacqueline said, is the State Health Insurance Assistance Program, and we provide free and impartial help with Medicare. We've been in Indiana for about 35 years now, and there is a SHIP program in every state. We are funded by the Administration for Community Living, and in Indiana, we are housed with the Indiana Department of Insurance. And we are not affiliated with any insurance company, and we do not sell insurance. However, we can do basically everything that an insurance agent can do. We can enroll you in your parts of Medicare. We can help you with appealing issues that you might have with your either doctor's office or with the insurance company directly. And our mission is to empower, educate, and assist you with your Medicare choices and coverage. So our main focus is educating you on the pros and cons of the different options. So without further ado, let's start educating you on some pieces of Medicare. So what is Medicare and who is Medicare for? So Medicare is federal health insurance, and it is for three groups of individuals. So 65 years or older, when you're on disability for at least 2 years, and that's any age. So we do have younger adults, and we also have children on Medicare because of this disability. And then if you have end-stage renal disease or ALS, you get Medicare automatically. As soon as you get that diagnosis from your doctor, you can enroll into Medicare. So there's two different ways that you may enroll into Medicare, your A and your B. If you're receiving any kind of Social Security income, whether that be Social Security retirement, Social Security disability, or SSI, then Social Security is automatically going to enroll you in A and B and send you that Medicare card 3 months before your Medicare will go active. If you do not receive any kind of Social Security income, then you need to start the process yourself. You will not be automatically enrolled. So you will need to apply for Medicare A and or B, and you can do that by going to the Social Security Administration.gov website, and you can apply online. You can call any of the offices, or you can visit any of the offices. However, they are requiring appointments now, so you would still need to call to at least get an appointment scheduled, either in office or over the phone. Now, anytime that I mention Social Security in the context of Medicare during this presentation, and if you're with the Railroad Retirement Board, you're going to contact that office instead of Social Security. And ideally, you want to start applying for your A and or B 3 months before you turn 65, because it can take a little bit of time to get enrolled in Medicare and to get that Medicare card. So if you have to enroll yourself, specifically with when you're turning 65, you have a 7-month window to get your Medicare set up. So 3 months before your birthday, your birth month, and then 3 months after. So if your birthday is in October, you will have July, August, September that you can start applying for your A and B. And if you enroll in any of those 3 months before your 65th birthday, your Medicare will start the first of the month. If you apply in your birth month, and in this example, October, or any of the 3 months after November, December, January, your Medicare will start the first of the following month from the month you applied. So one of the most common questions that we get is, what if I'm still working? What if I have employer insurance? What if my spouse is still working and they have employer insurance for me? Well, in those cases, you can delay your Medicare. If you like your employer insurance, if it is working well for you, if it's affordable, you can stay on that employer insurance through your employer or a spouse's employer until you retire or lose that employer insurance. You do not need to alert Social Security ahead of time. Now, it does have to be something that we call creditable insurance. That means it's as good as or better than Medicare. Now, generally, the size of the employer is what matters. Now, on here, I have 20 employees when you're applying for Medicare because you're 65 or older. We actually just recently were informed by CMS, Centers for Medicare and Medicaid Services, that if you are on any kind of employer insurance and you're getting Medicare because of age, or that's why you're eligible for it, that employer actually does not have to have 20 employees or more. It can be any size. It can be 2 employees. It can be 10 employees. It could be 20 employees or more, but it doesn't need to be. So you can still delay your Medicare penalty-free if you have employer insurance and you're getting Medicare, or you're eligible for Medicare at 65 years or older. Now, where this number still comes into play is in determining what insurance would be primary or secondary. So if you've decided that you're going to keep both the employer insurance and both your A and B of Medicare, if the employer has under 20 employees, your Medicare will be primary and your employer would be secondary. If there are more than 20 employees, Then your employer insurance is primary and your Medicare is secondary. Now, something to know is Medicare does not make for great secondary insurance. It doesn't really pay out anything. So if you are going to go and take your Medicare before you retire or your spouse retires, you may want to consider not taking the employer insurance in that situation when Medicare would be secondary. But this is something that a SHIP counselor can help you navigate and determine what is the best situation for you. Now, if you are getting Medicare due to disability and you or your spouse is still working and you have employer insurance, the size of the employees does matter in this situation. There does have to be 100 employees or more that works at the company. Otherwise, you do have to take your Medicare or you would get a penalty. So if you're getting Medicare due to disability and the employer has 100 or more employees, you can delay that Medicare penalty free. Again, it can be through a spouse's employer. It doesn't have to be through yours. When you are ready to take your Medicare, if you have decided to delay it, you probably do want to start that process 2 or 3 months prior to knowing that you're losing that employer insurance, so it can start the day after your employer insurance ends. And then there is a form, it's called the L564 form, that the employer will need to fill out, and you will need to send that to Social Security when you apply for your Medicare. And this form is what tells Social Security that you've had employer insurance and not to give you a penalty for delaying your Medicare. So let's start diving into our different parts of Medicare. And keep in mind, this is just a brief overview of all the main pieces of Medicare. There are so many other pieces of Medicare that we just don't have time to cover in presentations like this, so we pick the highlights. So if you have questions on any of these, you can get in touch with Jacqueline or myself, and we can go over your specific situation. All right, so Part A, we call this the hospital insurance, but I also call it the inpatient insurance because you do have to be inpatient somewhere to have Part A covered. So inpatient hospital care, inpatient nursing home for rehab only. Medicare does not cover long-term care. It's just short-term rehab. Inpatient blood, inpatient non-religious, non-medical health care in approved religious non-medical institutions. And then home health care and hospice care. And hospice care would be given either at your home, a family member's home, a hospice house, nursing facility, or even there are a couple hospices in Indiana that I'm aware of that actually can provide hospice care while you're in the hospital. So that can be helpful depending on your specific situation at times. Now, Part A and Part B of Medicare has out-of-pocket costs. Medicare is not free. So there is, for the premium for Part A, generally there's no premium. Part A is generally known as the free part of Medicare, and that's because as we work, then we are paying for the premium of Part A. It comes out of our FICA tax, and then when we go to retire, we don't have to pay a premium for Part A. Now, if you're someone that did not get in all of your work credits and that you are not eligible for Social Security retirement because of that, or you have not paid enough into the Part A system for the premium, then when you go to take Medicare, you can still get Part A. You just have to pay for it. And depending on how many credits you have earned already, will determine what that premium is. It can be anywhere from about 280 to about 550 a month. So there are out-of-pocket deductibles and copays. So when you go to a hospital and you're inpatient, your deductible is $1,632, and you have no copays for the first 60 days in a hospital. Now, Part A has something called benefit periods, and it can be a little confusing. So benefit periods just tracks and determines where you are in your days of your benefits for hospital and nursing home. So when you enter a hospital inpatient, let's say it's the beginning of the year, you go in, your benefit period is going to start, and it's going to determine where you are with your days with your benefits. And you go to the hospital, you go to the nursing home for rehab, you go home. If you're home for longer than 60 days, then when you go back to the hospital inpatient, your days restart. You'll pay the deductible again. You'll start at day one. But let's say, you've gone to the hospital, nursing home, you're home, but you're only home for 20 days and you have to go back to the hospital and you're inpatient. You won't pay a new deductible, but you also won't start that stay on day one. Let's say you had been in the hospital for 40 days already. So when you go back in a benefit period, you're going to start that stay in the hospital at day 41. So you'll be in your middle of your days 1 to 60, so you won't have any coinsurance still, and you won't have to pay another deductible, which can be nice. But it's very important to know that, because while you do get a lot of days in your benefits for hospital, you only get 100 in a benefit for nursing home rehab. And nursing home rehab can eat that up very quickly. You may have already stayed in the nursing home a good 60, 80 days in your first admission to the nursing home in a benefit period. And then if you have to go back while still in that benefit period, there's a potential you'll run out of days. So it's just very important to know that this is how Part A works. And this is the only part of Medicare that works this way. All right, so if you're in the hospital days 61 to 90 in a benefit period, you will pay $408. And then if you are having a major health issue and you are just not able to discharge either to a nursing home or back home, if you're still in the hospital at day 90 of a benefit period, you can decide to use your lifetime reserve days. Now, this is a one-time benefit. So once you use them, you do not have them anymore. So you'll get 60 days from your lifetime reserve days, and that's it. And if you're using your lifetime reserve days, you'll pay $816 per day. And then if you're still in the hospital at day 90 or after using your lifetime reserve days, you will pay 100% in the hospital. At that point, the hospital discharge planner or social worker is probably going to be talking to you about other insurance, such as Medicaid, and helping you with that process. Medicare Part A also helps with inpatient mental health care in a psychiatric hospital, and you get 190 days in a lifetime. Then nursing home for rehab, the first 20 days, you do not have a copay. And then if you are in the nursing home from days 21 to 100, you'll pay $204 per day. And then if you're still in the nursing home after day 100, you will pay 100%, unless you get Medicaid or have Medicaid. And then home health has no copay costs. But if you do get durable medical equipment while you're with home health, that's a 20% copay. A couple things to mention on this slide with the numbers before we move forward is These are all the numbers for 2025. We do not have most of the numbers for 2026 yet. I was hoping that we would have those before this presentation happened, but unfortunately we don't have those yet. But they should be coming out any day now, and you can either reach out to SHIP or Jacqueline for those numbers, or it's going to be all over the news as well when those numbers come out. The other thing that I wanted to mention is if you have secondary insurance, the numbers that you're seeing on this page, and then when we talk about the Part B costs, are either going to be non-existent or different. So if you have Medicaid as a secondary, you won't have an out-of-pocket cost. All of these numbers will be zero. Medicaid will pay for these numbers. If you have COBRA, retiree, or even employer that is secondary, those options will help cover some or all of your secondary options. And then when we get to later slides and start talking about our Medicare supplement or our Medicare Advantage, we'll go over how those options help pay for these costs and your Part B costs. All right, so let's dive into Part B. So Part B is our outpatient coverage. So doctors, outpatient medical, or even outpatient surgery, labs, durable medical equipment, diabetic testing supplies, and preventative services. If you're in the hospital and you're outpatient, Part B is going to cover you, even though we say that Part A covers hospitals. You have to be inpatient for Part A to cover. So if you go to the emergency room and that does not end in an inpatient stay, or you do stay at the hospital, but it's outpatient, Part B is what is going to cover you for that stay. Now, these numbers are also for 2025. We do not have the numbers for 2026 yet. So the premium for this year is $185 a month for Part B. And then your deductible for Part B is $257. So much smaller than the Part A, and we don't have those crazy benefit periods. All right, so let's talk about preventative services. Medicare and Part B specifically wants you to stay as healthy as you possibly can. So they offer you all of these services at 100%. So there are no copays when you have any of these services done. So we're going to talk about a few of these, but not all. So Medicare allows you to have a Welcome to Medicare preventative visit and a yearly wellness visit. Now, these are not normal head-to-toe physicals. This is a time to meet with your doctor to go over any of these screenings or preventative services that you might need in the coming year. If the doctor does anything else in the visit, like lab work, then you actually will owe a copay. But if you just are seeing your doctor for the approved Welcome to Medicare visit or the yearly wellness visit, and the doctor doesn't do anything else in that visit, then you don't have a copay. So every once in a while, I'll get a call from a client that goes, well, the doctor charged me a copay, and I watched your presentation and you said this was all free. So why do I have a copay? It's because most likely the doctor did something outside of the scope of the preventative visits that is allowable by Medicare. There's also a wide range of screenings: diabetes, depression, heart, cancer, bone mass. There's also vaccines. So Part B covers your flu shots, hepatitis shots, COVID vaccines, so COVID boosters, pneumonia, and RSV. Now, when you go to the pharmacy, if you're getting any of these vaccines at the pharmacy, it's important to make sure that they have your Part A and Part B card on file, because that is who they have to bill. And sometimes If you go to the pharmacy, there might be some billing errors because they're not as familiar most of the time or some of the time on who to bill for some of these vaccines. Because Part D also covers some vaccines. Part D covers your tetanus vaccines and shingles. So they might just be used to billing Part D. Now, if you go to your doctor's office to have these vaccines done, usually there's fewer billing issues, but it's perfectly fine to go to either the pharmacy or your doctor's office. Just know that you need that Part B on file at the pharmacy. And you may want to mention, hey, you're going to bill Part B, right? And not Part D. So just keep that in mind. The other thing I wanted to mention is mammograms and colonoscopies. So when you are having your yearly mammogram or your 10-year or 5-year colonoscopy, depending on what your doctor says you need to have done, if it's just your preventative yearly mammogram or 5-year, 10-year colonoscopy, you have no copay because those are preventative. However, let's say you go to your doctor and you say, okay, doctor, I'm feeling a lump. Doctor feels they feel a lump. So they're going to order a diagnostic mammogram. Same if you're having some tummy issues and the doctor feels you need a colonoscopy to rule out some things. That is now diagnostic. And if you're having a diagnostic procedure, you will get a copay. That's another call I get. Well, I had a mammogram and it should be covered at 100%. Well, were you having any kind of symptoms that you talked to your doctor about? Yes. So that's why. So if you do get a bill, that is why. If you're having an issue and it's not your normal yearly mammogram or routine colonoscopy, that's why you're going to have a copay. Now, if it was a routine exam and you're getting a bill, you want to call the provider that you had that test done through and let them know, hey, did this get coded right? Because there's about 1,000,005 billing codes, and sometimes they make a couple mistakes. So sometimes we have to call and just ask. But if you are getting a bill and you don't know what to do and you don't think you should have to get a bill, you can give SHIP a call and we can help you navigate that. All right, so let's dive into Part D. So this is our prescription drug coverage. And there is 2 ways that you can get Part D Medicare drug coverage, either through a standalone prescription drug plan or through an Advantage plan. So everything that I talk to you about with the medication coverage applies to both types, whether it's a standalone Part D or Part D in Advantage plan. So all of these plans are approved by Medicare. You're with a private insurance company, and if you have Medicare, you can get Part D coverage. Now, they are flexible in design, so each plan may have your prescriptions at a different tier. Your copays may be different, your co-insurance might be different, and what they cover is different. Now, they do have to offer at least a standard level of coverage, and every year, your copays, premiums, deductibles may change. So that's why it's very important to review your plans every year. And we're going to talk about that in a little bit when we talk about open enrollment. So Part D does not always cover all of our prescriptions all of the time. It depends on where we are or why we're getting the medication. So if we're in the hospital inpatient, or we're in the nursing home, or even on hospice, Part A is going to cover our medicine. If we are getting dialysis, if we're getting an infusion, if we're getting IV antibiotics, even at home or an infusion center, Part B will cover those medications. If you go to your doctor's office to have a shot, the doctor is actually going to bill Part B, so it will not be covered by Part D. And then generally, if we're going to the pharmacy we're picking up our routine prescriptions, then those are generally going to be covered by Part D as well. So let's talk about our Part D structure. Now, this structure was new or is new to 2025, and this structure will continue into 2026. So if you are on brand name medicine or tier 3 or higher medicine, you are subject to any deductible that your plan has. And we actually do know the deductible for 2026. So that is going to be $619 next year. This year it's $590. So common brand name medicine is Ozempic. Commonly for diabetes, it's not insulin, but it is an injectable. So if you were on Ozempic and your plan had a deductible listed, when you go to pick up the Ozempic for the first time in the year, you will pay that deductible. Then, once your deductible is met, if you are subject to a deductible, because if you're just on generics, you won't have to worry about the deductible. So then you'll move into the initial coverage period. And this is where you're going to pay up to 25% based on the retail cost of the medicine. Now, if it's generic, you may not have any copays, but the higher the tier, or if it's a brand name, the more you'll pay out of pocket. So continuing with Ozempic, when you get into the initial coverage period, generally you're going to pay around $47 for the copay for Ozempic. Now, there is a max out of pocket. Last year and previous years, it was about $4,000. This year, it went down to $2,000. Next year, 2026, it's going up just a tiny, tiny, tiny bit. It's going to be $2,100 is your max out of pocket. So once you hit that number, if you do, then you will go into catastrophic phase. And that's where for the rest of the year, you won't have any copays at all. Now, I've seen people reach that max out of pocket very quickly because they're on a lot of medication and a lot of expensive medicines. So I've seen some reach it in February. Right into the second month in the year, they've already hit 2,000. So then if that's what happens, zero copays for the rest of the year. It's more common that someone might reach their max out of pocket in the middle of the year or even towards the end of the year. Or you might not hit it at all because you're not on expensive medicine. All right, so let's dive into our two secondary options for Medicare. So on the left, we have our minimum coverage once eligible. Now, remember, there's that loophole that if you have employer insurance, you may be able to delay your Medicare. But let's say you don't have employer insurance. So you need to go ahead and take your A, your B, and get Part D if you do not have creditable drug insurance. Now, having just A and B and no secondary option is risky because specifically with Part B, Medicare pays 80% and you, the beneficiary, pays 20%. There is no max out-of-pocket protection for Part B. So that means you're going to pay that 20% over and over and over again, and there's no cutoff. We had a client up in Lake County, up in East Chicago, who just had A and B and D. He had a medical emergency and had to take an ambulance trip down to Indy. His 20% copay, not the full cost of the ambulance, but his 20% was $15,000. So we want to make sure that you're as protected as possible for either unexpected medical issues, or if you do have chronic health issues and you know that you're going to be in and out of the hospital or having lots of medical tests or appointments. So outside of Medicare, you could have VA, you could have TRICARE, you could have Medicaid, you could have COBRA, employer, or retiree. Those are all potential options. But those are only for specific situations or specific individuals. So there are two options when it comes to secondary for Medicare. Our first option is a Medicare supplement. So you have original Medicare through the government. So they're your insurance provider. And then you have your supplement as secondary to help pay for your Part A and or Part B out-of-pocket costs. And then option 2 is a different way of doing Medicare. Your Advantage plan, your managed care insurance provider, manages your A, B, D benefits, along with providing you some extra benefits. Now, there are copays and deductibles with Advantage plans. However, it has a max out-of-pocket protection. So if you hit that number in a year, the plan will pay at 100%. So let's dive into both of those options some more. So first we have our supplement. We also call this a Medigap. So if you hear me say supplement, I mean Medigap. And if I say Medigap, I mean a supplement. So you are with a private health insurance company. All of these plans have to be approved by the Indiana Department of Insurance. So that gives you a level of protection. There are no networks with Medigaps. You can go anywhere in the United States that takes Medicare. And if A or B pays first, your supplement has to pay out second. So Medicare is primary and your Medigap is second. So these are all the different plans available to someone for a supplement. Now, I do want you to make note that Plan C and Plan F are no longer available to anyone that started their Medicare on or after January 1st, 2020. However, if you still have a Plan C or F, you can keep that. Or if your Medicare started before 2020, you can actually still purchase a Plan C or a Plan F. And Plan F covered everything. All of your copays, all of your deductibles for both parts. So right now, we don't have any widely available plans that will cover your Part B deductible. However, Plan G is very comparable to Plan F. It has the most coverage at the moment. So it covers your Part A coinsurance and your Part A deductible. So you go inpatient to a hospital and you owe nothing. You go to the nursing home. That coinsurance is also covered. So you owe nothing when you're in the nursing home for rehab. It does cover your Part B coinsurance, some blood. Like I said, it doesn't cover the Part B deductible. So how the Plan G would work is beginning of the year, you pay your Plan G premium every month. You pay your Part B premium every month. And then beginning of the year, you go see your doctor, you have some tests done. You're going to pay up to that deductible amount. And then the plan will kick in, your Part B will kick in, your Plan G will kick in and cover you at 100% for your Part A and your Part B out-of-pocket expenses for the rest of the year. Now this year, the Part B deductible is $257, so you would pay up to that amount. And then excess charges. What are excess charges? So there's a couple different relationships your medical provider may have with Medicare. It may not take Medicare at all, or it might take Medicare assignment. That means that when you go see your doctor or your provider and they're going to charge what they charge for their visit, Medicare will reimburse them for their reduced amount, and the doctor's office is fine with that. They'll also charge you your copay that you either have to pay or your supplement will pay, or your whatever secondary options you have. Then if the doctor just takes Medicare, but doesn't take assignment, that means that they'll still take Medicare's reduced reimbursement amount. They'll charge you your copay, and then they can also charge you an excess charge, which is an additional up to 15% type of copay that you would have to pay. So if you go to a doctor that has excess charges and you have Plan G, that will be covered for you. And then several of these options have foreign travel emergency. So if you are traveling overseas and something happens medically, your supplement will help cover some of those medical costs. Now, I want to point out Plan D very quickly as well, because we're going to circle back to this when we talk about Medigaps for under 65. So Plan D covers everything that Plan G does, except the excess charges. So keep that in mind when we circle back around in just a couple slides. So you do have to pay a premium for your supplement, and it's going to depend on your age, where you live, the company selling the policy. Now keep in mind, a Plan G is a Plan G across the board. Same with a Plan D or a Plan N. Coverage is the same between companies. The only difference is the premium they'll charge you. So keeping that in mind and knowing that these plans have to follow the rules and regulations set by the Indiana Department of Insurance, you could easily pick the cheapest company for the premium charge and be covered the same as you would if you paid $300 at another company instead of the $150 with the cheapest company. And if something happened to the company you're with and they don't sell plans anymore, or they go bankrupt or insolvent, then you're going to get a window, a special enrollment, to get to another supplement. So there's protections in place. But that's something that you can discuss with a SHIP counselor on how that works in more detail. Discount, so women get lower premiums. Same with non-smokers, and then married couples might get a 10 or 12% discount on their premiums if they both have plans with the same company. Now, supplements are the only type of Medicare that charges or looks at medical underwriting. So this is meaning that they can look at your health history and they can either deny you or charge you a higher premium. So there's something that we're going to talk about. This is the Medigap open enrollment. So when you're new to Medicare, when you have Part B, it now no longer matters if you're over 65 or under 65, and we'll talk about that in the next slide or two. So you have Part B for the first time, doesn't matter your age. For the first 6 months, you can get a Medigap with something called guaranteed issue. Guaranteed issue is a very important term, and it means that they will not look at your health history. They will not do medical underwriting. So you are guaranteed to get a plan, and you cannot be denied during guaranteed issue, and they won't charge you a higher premium. So if you are considering getting a Medigap, it's very important if you have health issues to know when your guaranteed issue periods are and that you're not missing it if you do truly want a supplement. Now, you can still try to get a supplement without guaranteed issue any time of the year. But if you have health issues, that's when there's a risk and a potential that you may not be able to get a plan. However, if you're relatively healthy, I have seen individuals get supplements well into their 80s without guaranteed issue. So it just depends on your specific situation. Now, let's talk about what's new to Indiana this year for those under 65. So first, a little bit of history. Prior to 2025 in Indiana, individuals on Medicare under the age of 65 were not allowed to have guaranteed issue. And if they were able to get a supplement, they could only get Plan A, which only covers four things. Your Part A coinsurance, your Part B coinsurance, blood, and then I don't quite remember the fourth thing, but it did not cover any of your deductibles. And the plans, the companies could upcharge you if you're under the age of 65. So someone that's 65 or older might get a Plan A for about $40 a month. Someone under the age of 65 was quoted anywhere from $250 to $700 a month. So luckily, Indiana passed a law that took effect January 1st. And anyone who is under the age of 65 and on Medicare, the first 6 months of getting Medicare, they get guaranteed issue, just like someone who is 65 or older. And then when they turn 65 moving forward, they get that 6-month guaranteed issue window again. Now, there's a couple things to know about pricing. So for plans A, B, or D, not to be confused with our parts, but our plans for our supplements, you are going to be able to get those plans for the same price as someone at the age of 65. Now, you can get a Plan G, a Plan N, any of the other plans that are available if you are under 65. However, there is no price protection for someone under the age of 65. So if you try to get a Plan G and you're not 65 yet, they are going to charge you up to 200% more. So if a 65-year-old can get a Plan G for $100 a month, under 65 individual might have to pay $300 a month. So this is why I wanted you to keep Plan D in your mind. Remember, it's very comparable to G. Neither option pays the Part B deductible. And then the only difference between D and G is the excess charge coverage. So if you're under the age of 65, you could do the Plan D option. Just know that you want to be mindful about going to providers that take a Medicare assignment, or just know that if you do get a doctor that takes Medicare but not assignment, you might have to pay that up to 15% copay. That way, you have a plan that's going to cover most of your out-of-pocket costs. You're not going to have to pay $300 or more a month for it. And then when you turn 65, you get the guaranteed issue window again. And if you want to move to a Plan G at that point, you can. The other thing that we have going on, this is new to Indiana in 2026 for the supplements. So this is called the House Enrolled Act 1226. So moving forward, starting next year, 60 days before your birthday and 60 days after your birthday, you get guaranteed issue again. So this guaranteed issue will allow you to call a different company, not the company you're with. You do already have to have a supplement. So you're with one company, you have a Plan G, you want to see if you can get a Plan G with another company for a lower premium. So you're going to call another company, they're going to apply guaranteed issue, and they're going to let you know how much they would charge you for the same plan letter that you currently have. So you cannot go from a G to a D or a N to a G. You have to go from G to G. So keep that in mind. But this is the hope of this is that individuals can price every year around their birthday to see if they can find a plan with a lower premium. So that will start January 1st. Sometimes when new laws come out with Medicare, sometimes the insurance companies get a little bit confused on it. They may not have heard of it yet. So if you do struggle with this rule next year, or you want to talk to someone more about it, this is another thing that you can reach out to a SHIP counselor with. All right, so let's talk about our other choice. So Advantage plans. So you're with a private health insurance company, and they're going to provide you with your A and B benefits. So they are part of the Medicare program. They have to be approved by Medicare. Most of them do provide Part D coverage. And then you might get extra benefits: vision, dental, hearing, gym memberships, over-the-counter debit cards for supplements, home delivered meals, and many, many more extra benefits. They do go by different names: Part C, health plans, replacement plans, and I've even heard choice plans. And then they are based on your zip code, so if you move, you may have to change plans. Medicare will pay the plan every month for your care. They do have to provide the exact same original Medicare coverage services. However, they get to decide if your doctor orders you an MRI. They get to decide if you will actually have that MRI approved or not. So we do know that there is a little bit more of a risk with Advantage plans since it is a managed care type of insurance. We do see more denials on Advantage plans versus original Medicare. And I'm not saying it's going to deny everything. It's just something to be aware of, that that's a potential. Now, you do still have the same Medicare rights and protections, right to appeal, right to quality care. You do have to follow networks with the Advantage plans. And all of the costs that I have mentioned prior to this slide is out the window when it comes to Advantage plans. Every Advantage plan gets to set their own copay and deductible amounts. If you move or your Advantage plan leaves Medicare or no longer sells in your area, you can get a special enrollment to switch to another Advantage plan, or you can go back to original Medicare and you'll have guaranteed issue to get a supplement at that point. You still pay your Part B premium. Now, there are some assistance programs through the state that help pay for Medicare costs, and that's something that SHIP counselors can screen you for. And then some Advantage plans have a premium, but if they do, it's like maybe $20, $30. They're not expensive when it comes to the premium. Now, again, you will have deductibles, co-insurance, and co-payments. And you cannot have a Medigap policy and an Advantage plan at the same time. It's either or. Now, there are two different types of Advantage plans. There's an HMO option, which means you can only go in network. And if you go out of network, you will pay 100% of the cost. You do need to have a primary doctor assigned to you at all times. You do need to see the primary to get referrals for specialists. Then we have our PPO option. And this option allows you to go in network or out of network. Now, if you have a mix, so you've gone to some in-network providers, but you've gone to out-of-network providers, your max out-of-pocket might get a little higher, and you might have to pay higher copays if you go out of network. However, you will not pay 100% of the costs. So this gives you a wider range of providers to work with and a little bit more flexibility. You do not need to have a primary care doctor at all times, and you generally do not need a referral to see a specialist. So when can you get an Advantage plan? And this slide also applies to Part D plans as well. So during your initial enrollment period and during the fall open enrollment period. So that's coming up. It's a week from today, October 15th to December 7th. That is our busy year. That's when you're not required to, but it's highly recommended to review your drug plan or your Advantage plan. And you can change multiple times if your situation changes throughout open enrollment. And every year, the plan that you're on can make changes for the new year. The premium might change, the copays, the deductibles, the coverage might change. The other thing that happens is your situation might change. Your providers might change, or your medication might change. And the medication that you're on is really what makes a plan better or worse for you. So it's always a good idea to just review your plan at least once yearly to make sure that you're on the best plan for you and you're not shelling out more money than you really need to. Now, there's also special enrollment periods. And again, this applies to Part D or Advantage plan. So if you move, if you have Medicaid and Medicare, if you lose secondary insurance, if you enter, live at, or leave a long-term facility like a nursing home, either for long-term care or rehab, if you have extra help, these are all situations that you can change plans. And if you are wanting to change plans, but you're not sure if you're in an enrollment period, we can help it ship and we can review your situation and let you know if you qualify or not to change plans. We also, this is just for Advantage plans. So if you start the year on an Advantage plan from January 1st to March 31st, you can review your plans again, and you can either move from Advantage plan to Advantage plan, or you can go back to original Medicare, get a Part D plan. You can try to get a supplement, but you will not get guaranteed issue during this time. And then you can only make one change, and it will start the first of the following month. So if you make the change in January, it will start February 1st. All right, so let's wrap up before we move into some questions. What choice is for me? How do I know? So before we look at that, let's do a quick review of each option. So our original Medicare with a Medigap. So that's going to cover your A and B benefits. CMS provides your Part A and Part B benefits directly. You have your choice of medical providers that take Medicare. A and B coinsurance is paid by all Medigap plans, and your deductible coverage is provided by some. It will cost more now in monthly premiums, with few medical bills when insurance is used. And then our Advantage plan option covers A and B benefits and additional benefits. Coverage provided by private insurance companies approved by Medicare. In most plans, you need to use plan doctors, hospitals, or other providers. You may pay a monthly premium on top of your Part B premium and copays and deductibles. Usually it costs less than monthly premiums, but you're responsible for leftover medical bills. All right, let's look at our usual candidates. So on the left, we have someone that is a better fit for original Medicare with a Medigap. This might be someone coming into Medicare with pre-existing conditions and high medical costs, someone not wanting to take the risk of high medical costs due to future diagnosis. Maybe they spend part of the year in a different part of the country and wants the ability to see any doctor that takes Medicare. And you're usually willing to pay higher monthly costs, and in return could have lower to no out-of-pocket medical bills. Then over here on the right, we have our Medicare Advantage plan. Someone who comes into Medicare healthy and doesn't go to the doctor or hospital often, assumes they will continue to be healthy, financially cannot afford to pay the higher monthly premiums with original Medicare and a supplement, and willing to stay in a smaller network of doctors and hospitals. All right, so that's our presentation. Here is our contact information with SHIP. You can find us on social media. You can visit our website, or you can call our 1-800 number. Now, here is my contact information. Now, I do cover the Northwest region of Indiana, so I do have 11 counties. However, I can assist anyone in any Indiana county. And then I am going to turn it over to Jacqueline, who has some questions for us.
Thank you, Megan. Yes, we do have some questions. Just yesterday, I received this one. Will I have Medicare coverage while traveling internationally?
Good question. So Medicare coverage A and B, no. Advantage plan, no. But if you do have a supplement and you have chosen one of those supplements that have foreign travel emergency coverage, then those plans will pay up to 80%. And you would want to speak directly to that supplement company to get educated in all the ins and outs of that coverage.
Got it. Okay. And then next question, how do I find local unbiased Medigap insurance agents?
Good question. So, insurance agents are generally not unbiased. Okay. Now, there are good agents, and every once in a while we run across bad agents. Now, an agent, an insurance agent, a broker, they are only contracted generally with just a few companies. And if they're not contracted with every single company out there, they are going to be biased because they are only going to be educating you on the companies that they are contracted with. And they may help you get into the lowest plan of the ones they're contracted with, but that may not be the ultimate cheapest plan out there. So really the only unbiased, true avenue to go with is contacting a SHIP counselor. Again, we're not insurance agents, but we can do most everything an insurance agent does and help navigate you through the system.
Awesome. Okay. We have a few more. Can I get financial assistance with Medicare costs?
You sure can. So there are state assistance programs for your A and B. There's what we call partial Medicaid. So that isn't full Medicaid health insurance. It's for people who have Medicare and might need help paying for your premiums, copays, and deductibles. They're called Medicare savings programs, but they are based on income and resources. So you can either contact your local Medicaid office or SHIP for that assistance.
Okay. And the last question, we get this quite often actually. Does Medicare cover long-term care like nursing homes or custodial care?
Good question. Yes, we do get that one common. And unfortunately, it doesn't. However, we can kind of talk to you about your other options. You know, are you a veteran? VA may pay for long-term nursing home. Do you have long-term care insurance? Do you have Medicaid? We're going to help navigate you with those options and point you in the right direction. So Medicare itself does not cover long-term, but there are options out there that we can help you understand and point you in the right direction.
Perfect. Okay. Well, that was our last question. As we wrap up the presentation, if you guys have any questions about today's webinar, please feel free to contact either me or Megan. We'd be happy to help you. And thank you again for joining us and have a wonderful day.